Imagine a 7-year-old boy, full of life, suddenly appearing lethargic, uninterested in food, and producing unusually dark urine. Just a week ago, he was treated for a simple throat infection. Now his face is puffy, and his legs show signs of mild pitting edema, a condition where pressing the skin leaves a small indentation that takes some time to disappear. What could be causing these alarming changes? Upon examination, the doctors find no sign of fever. However, they do discover traces of blood and excess protein in his urine. These clues, combined with the recent history of a throat infection, lead them to a diagnosis of acute post-streptococcal glomerulonephritis, often simply referred to as post-strep-GN. But what is post-strep-GN, and how does it occur? Post-strep-GN is a kidney disease that develops following an infection with certain strains of Streptococcus bacteria, often manifesting after a throat or skin infection. It predominantly affects children, but can occur in people of all ages. The underlying pathogenesis of post-strep-GN isn't due to the bacteria directly attacking the kidneys. Instead, it's a result of an immunological response gone awry. The body's immune system, in its attempt to fight off the streptococcal infection, inadvertently produces antibodies that form immune complexes. These complexes can become lodged in the glomeruli, the tiny filtering units within the kidneys. This is known as immune complex deposition, the answer to our opening question. The presence of these immune complexes in the kidneys triggers an inflammatory response. Inflammatory cells are recruited, and they release various substances, including enzymes and free radicals. These substances damage the glomeruli, resulting in the symptoms of post-strep-GN, such as blood and protein in the urine, edema, and hypertension. It's important to note that post-strep-GN is not caused by tissue damage by the immune system, massive histamine release, local release of inflammatory cytokines, or T-cell-mediated pathogenesis. While these processes can contribute to other disease states, they are not the primary drivers of post-strep-GN. So, to recap, the symptoms of post-strep-GN, dark urine, lethargy, anorexia, facial puffiness, and edema, are the result of an overzealous immune response to a streptococcal infection. The immune system forms complexes that become trapped in the kidneys, causing inflammation and damage. The primary pathogenesis is immune complex deposition, not direct tissue damage, histamine release, cytokine release, or T-cell mediation. Understanding the cause and symptoms of diseases like post-strep-GN helps healthcare professionals better diagnose and treat patients. It also highlights the complex and sometimes unpredictable nature of our immune system. So, while it may seem like just a throat infection, the body's response can lead to unexpected complications, emphasizing the importance of timely treatment and close follow-up. And on that note, we'll conclude our exploration of post-strep-GN. Remember, every symptom tells a story, and understanding that story is the key to effective medical care.